So now you can see the pictures. Okay, so this is the book cover of the first edition of the book that I wrote about Dad. You know, they called him Medicine's Michelangelo, and they called him the Dean of Medical Illustration. They called him the great medical teacher. Well, I called him Daddy. He had a large art studio in the family home, and I would go there with some regularity while he made his beautiful pictures, and we would talk about things that what fathers and daughters talk about. And sometimes he'd tell me about the pictures he was working on. For example, if you had a picture of the heart he was working on, he would tell me about how it worked to circulate the blood. Or if it was a picture of the stomach, he would explain digestion to me. But you know, it was always the pictures that told the story. So what I'm going to do now is I'm going to show you some pictures and I'm going to tell you his story. First, I want to tell you a little bit about the Netter family, and particularly about Edward Netter and Frank Netter and their relationship. Edward Netter was the great guy, and I love him, and his wife Barbara is just such a lovely person. They're just lovely. But my father and Edward's father were double first cousins. Double first cousins. Two sisters had married two brothers. And the two families were very close, as you can imagine. And together, they had a stationery store in the theater district in New York. And all the people in the family, they worked in a stationery store. I think Edward might have been a little bit younger. He didn't do that. But my father was born in 1906. And so by the time he was 10 years old, he was working in the store. He was stacking the magazines. He was delivering the newspapers. And he would look at the pictures in the magazines and in the newspapers. They didn't use photography much in those days. All the pictures were done by the great illustrators. Oops. This is changing by itself. What is that? Whoops, please. Go back. All right. We'll have to catch up. So, this was the golden age of illustration. And Frank looked at the pictures and these people must lead wonderful lives. I want to be an artist. And he was always drawing pictures. He was trying to copy the pictures he saw in the magazines and in the newspapers, done by the great illustrators. Now, he missed the picture of his mother. His mother, he had drawn that picture when he was, can you put it back? One. Yeah, there she is. And she had been peeling potatoes and she had dozed off and he got a pencil and drew her pictures. He was 11 years old. And she told him, you know, Frankie, art is a very nice thing, but it's no way for a young man to earn a living. You need to be a doctor. But he made a deal with her. She would let him go to art school if he would go to high school and keep up his grades and go to college. And after college, if he couldn't make a go of art, then he would go to medical school. And so that's what he did. He found out about a place called the National Academy of Design in New York, and they had a school for an art school. And the classes were taught by the great academicians, the wonderful artists in New York. And he would go to high school during the day and he would go to the National Academy at night. So that's what he did. And then after art school, after high school, he enrolled at the College of the City of New York, City College. And he was doing pretty well there. He made this picture of the quadrangle. Looks very much like that today, except of course the trees are much bigger. And he was inducted into the Honor Society, doing well. And in the summer, after his first year of college, his mother went into the hospital for a hysterectomy. Now, in those days, they used drip anesthesia, and they used the open incision. They had no antibiotics. She got an infection. 4 days later, she died. And he cried and cried for days. He cried. Okay, that's it. I'm going to give up art. I'm going to be a doctor like she wanted. That's what he said. So he finished at City College, finished his 4 years with a Bachelor of Science, and then he went to New York University Medical College, as they called it. And of course, medical school was tough. They gave you a box of bones and you had to pass the test or you were out. But Frank Netter found he could best learn his subjects by making pictures. And into the anatomy lab he went with his colored pencils and his notebooks, and it wasn't long before his classmates started asking for pictures and his professors started asking for pictures. Could you make me a picture so I could study that? And could you make me a picture so I could use it in the classroom? And this thing keeps changing the pictures ahead of time. But so word got around that he could make these pictures. And he finished at medical school, he did well, and he went then to a 2-year internship. That's what they did then, 2 years, medicine and surgery at Bellevue Hospital. The oldest, and at that time, the largest hospital in the country. And the interns had enormous experiences at Bellevue. Bellevue had its own ambulance service, and one of the duties of an intern was to ride the ambulance and go into the tenements and into the apartments and get the patients and bring them to the emergency pavilion at Bellevue. And after his internship, he did he joined a surgery practice, and then he also was on the outpatient surgery staff of the Mount Sinai Hospital, a premier hospital in New York. But now it was 1933, the depths of the Depression. Nobody had any money. The doctor, he might get paid in barter, but nobody had money. But Frank Netter was moonlighting, paying his pictures. The pharmaceutical companies found out that he could make pictures that appealed to doctors. And they came to him asking for pictures to illustrate the functions of the new drugs they were making. But he felt very guilty about making these pictures. He felt he should be building up his surgery practice and instead of painting pictures. Now he was getting about $50 a picture. And that was pretty good money during the Depression. And he said, I'm going to ask a ridiculous amount of money. I'm going to ask $300 for the next picture, which is ridiculous. And they will go away and leave me alone. Well, the next advertising manager that came through that door wanted a series of 5 pictures. And Frank said, well, I have to get $1,500 for these pictures. And the man said, oh, no, I don't have the authority to do that. Yeah. And Frank was sure he was done with art for good. The next day, the man called him up and says, okay, I got permission. We will pay you $1,500 for each of the 5 pictures. Well, it wasn't long before I resigned. And for the rest of his life, devoted himself to making pictures, medical pictures. Now, this is an interesting project that he worked on. The Transparent Woman. Now, in San Francisco, they had just completed the Golden Gate Bridge and the Oakland Bay Bridge, and they decided they're going to have a huge celebration and have an exposition, and they would invite the companies to make exhibits, something like a World's Fair, which was actually going on in New York at the same time. And so the Shering Company was the lead provider of hormone preparations. And they came to Frank and they said, we want you to make an exhibit to showcase our work with hormones, use the female hormones to show puberty and the changes in menstruation and the changes in the breast and in the uterus during pregnancy and that sort of thing. And so Frank made this sculpture and he projected his paintings from underneath to show the change. Then it would rotate through the different paintings and show these the hormone flows and how it affected the human body. And then he got a recording, a synchronized recording with the changes of the pictures, a recording of a woman's voice explaining, this is what's happening in my body. And it was very daring for 1938, this was enormous risque. Well, she went to San Francisco, she was the biggest hit of the show. She had a baby every 15 minutes. And afterwards, she went, after the 2 years, she went to the Museum of Science and Industry in Chicago, where she continued having babies for up to a very advanced age. And then the Ciba pharmaceutical company came to Frank and said, we have a brand new preparation for the heart, a digitalis preparation. And we would like for you to make some pictures so we can put with your picture of the front of the heart on this little flyer, die cut in the shape of the heart, and your picture of the front of the heart, front of the flyer, picture of the back of the heart, the base of the heart, and the back of the flyer, and open it up, and there'll be cross sections, your pictures of the cross section of the heart, and we'll put this product literature superimposed over the pictures. Well, that was very popular. They sent that out to all the doctors in the land, and some of them wrote back and said, could you send me some more of those little flyers, but without all that writing all over it? And so they did. They made the flyer and they put a little tag on it, and they had not so much product literature anymore, but anatomy of the heart. And that the doctors were using these little flyers as paid for patient info education. And that was so popular, and then they made other flyers for other organs for which they had preparations, the liver or the kidney, et cetera. Then came the army, and all the men lined up to join the armed forces. It was a great swell of patriotism. And Frank joined the army, and he was assigned to the Army Medical Museum, which was then on the National Mall in Washington, D.C. He was assigned to redo the Army first aid, the training of the recruits had to be trained in some kind of first aid before they went off to war. And the first aid manual was a big heavy book, and it's totally inadequate. And so Frank knew exactly what to do, and it came out as a little 4x6 booklet, 100 pages, with a picture on one page and a few bullet points on the other page. And the soldiers could remember what they had seen in the pictures. In the heat of battle, they could remember the pictures. And I'm sure that little booklet saved a lot of lives. After this first aid manual, he made other little booklets, survival booklets, survival in the tropics, survival in the Arctic. He made a big book for training X-ray technicians with over 1,000 pictures in it. And one of the doctors, one of the people he met while he was in the army was another doctor in the army by the name of Michael DeBakey. And they were the same age, and they became fast friends. They became lifelong friends, actually. And they collaborated on a series of portfolios, about 12 pictures in a portfolio, just to shuffle together about 8 by 10 pictures. And Dr. DeBakey wrote the text, and they were like pictures to give to the doctors. The Ciba company published them and sent them to the doctors, these portfolios, to treat the wounded as they came home from the war. And they did three of the portfolios together. And that was so successful that after the war, Ciba continued to make these publish these portfolios, but with different topics, not necessarily, not injury topics from the war, but other topics that would be be of interest to the physicians. And Frank would make the pictures and they would invite the leading clinicians and researchers to write the text. And they sent that out to all the doctors, and they were so popular, they couldn't keep them in print. And so they decided that they would shuffle them all together, about 200 of these pictures and the text, and they would put them in a bound in an atlas format, and that they sold at cost for $5. And that was very popular. They couldn't keep that in print either. So they got the idea to make a periodical publication, a periodical with content of the forefront of medical progress. And these were very popular. They published them 4 to 6 times a year, depending on the year, and different topics. Now, there was a doctor at Philadelphia Children's Hospital by the name of C. Everett Koop, Dr. C. Everett Koop. You know that name because he went on to become Surgeon General of the United States. But then he was a young surgeon at Philadelphia Children's Hospital. And he was operating on newborn babies in the early 1950s. Nobody was operating on newborn babies in the 1950s. Now they do, but not then. And these babies were born with anatomical anomalies incompatible with life. Things like this baby with the esophagus opening into the trachea, or intestines up in the chest, or baby born without a rectum. And somehow SIBA found out about him, and he agreed to work with Frank Netter because, well, nobody ever turned it down working with Frank Netter because he had already become it had become very prestigious to work with Frank Netter. So sometimes he knew he was going to operate the next day. He'd call Frank up. Frank would be trained down in Philadelphia, watch the surgery, go back to New York, and make a picture. And then when they felt they had enough examples, Dr. Koop went up to New York and they sat together and put the booklet together. And when that came out, it was proof positive that these things could be done, and the pediatricians could send their babies to Philadelphia and they would be saved. So you see, the clinical symposium was never really intended for the specialists. It was intended for the general practicing physician. But in reality, all sorts of people used them. This is of the hand, this beautiful picture of the hand. Frank Netter was a master with drawing hands. Not every artist can draw hands well. And this was a real masterpiece, this clinical symposium. You can go to the art museum and you can see the paintings in the art museum and see who does good hands. And you see that the grand masters with good hands. This man is suffering from depression. Notice this is not a picture of depression. This is a portrait of a man suffering from depression. That's 2 different things. When I look at this picture, I see a lot of the training that he had at the National Academy. But more than that, I see the influence of the great illustrators, that he saw these pictures in the magazines and in the stationaries, in the family stationaries. And I think this sets Frank Netter's art apart. Here's a picture that he did. He did a series of 12 pictures for Armor Labs that they would use as giveaways at medical conventions and things like that. This is a country night call. I showed you the one of the medical students cramming for the exam, and I showed you the intern riding the ambulance, and I showed you the doctor with all the patients waiting in the outpatient surgery lab service. Frank was working for a lot of different pharmaceutical companies when, in 1953, the SIBA company came and said, we want to make a series of atlases of the entire human body in health and disease. That's an enormous project. Frank said, that'll take me 10 years. Yes, and we will pay you extra, not to pay for anybody else. Just work on this, and we'll also do the clinical symposium, but just work for us. And so when they signed that contract, SIBA became Frank Netter's patron. They paid him extra not to work for anybody else. So they signed a contract for 10 years, and the 10 years came, and the 10 years went. And they signed a contract for another 10 years, and then another. And finally, they signed a contract for the rest of his working life. This is the pharynx. He did this one for the volume on the digestive system. Reminds me of something Georgia O'Keeffe might have painted. Happened to my picture. Oh, then where you all here? Oh, the heart. There we are. So, well, you've seen this earlier today, but this picture became very well known. Man having a heart attack. So this went into the volume on the heart. Now the heart volume was ready to go to press, the big volume, and it was ready to go to press when news broke of heart transplantation, the first heart transplants. And SIBA and Frank agreed that they wanted to put this in the volume, and so Frank flew out to Palo Alto. He met with Norman Shumway, who had developed this procedure, and then came back and made the pictures, and they tucked it into the back of the book. And it's just such an innovative procedure that you can see the great veins are left in place, and only the great arteries need suturing, and so that would reduce the time in surgery by a great deal. And reduce the risk of the surgery. And this picture he made with a neuroradiologist, and Frank took the neuroangiogram that the neuroradiologist had made and superimposed it on the anatomy. And that was the first picture to relate the veins of the face and scalp to the underlying anatomy. Now this picture of the eye he made for the Atlas of Human Anatomy. SIBA got the idea that how many pictures do we have? They had over 4,000 pictures that Frank Netter had painted. And do we have enough to make a first-class anatomy atlas? And they went through all the pictures that they had. They made a wish list of what the book would look like. And then they said, well, we're only missing about 25 pictures. And so Frank painted those pictures. And this was the picture of the eye that he painted to go into that anatomy atlas. And this photograph of him, just a snapshot, appeared in the frontispiece of the first edition of the Anatomy Atlas. And it was, of course, 2 pages, full bleed across the 2 pages. And really very, very effective. So when the Anatomy Atlas came out, it went into every anatomy lab around the world, into every medical student's collection, the existing the physicians' libraries, and it was #1 book of the year. It's still now, it's in its 8th edition now, it's still a bestseller. So Frank Netter died in 1991. He left a great legacy. I think we all think that. He had won a lot of awards. If you want to know more about Frank Netter, my book is in its second edition, and I recommend that if you're really interested, because it's the only biography of Frank Netter.
So much. Thank you so much, Francine. Learning more about the life of Dr. Netter and the inspiration of our namesake really feels like the perfect capstone to this incredible day. Thank you so much. So I'm going to ask for exactly 7 more minutes of your time before we move on to the reception. We have a slideshow for you that shows the first decade of our school through photos of faculty, staff, and students as they are learning, bonding, teaching, and celebrating milestones. All right. Oh, I didn't see that it was sticking so much. I don't think I can fix that either. I'm wondering if I should show it at the reception.
I was thinking the same thing.
I think we should.
Great idea.
It's just
Like,
not
you know,
effective. I think we're gonna do that. My apologies. I think we're going to show the slideshow at the reception. Oh, great. Here. Oops, I did have dark. Oh, one more slide.
Yeah.
This. I'm gonna do my best. You're able to see the QR code and to grab it. So as a final element of the commemoration of our 10th anniversary, I'd like to present to you QU Netter, the first decade, a year-long oral history podcast series. It starts with 3 episodes that chronicle the events of the first 10 years through the experiences of the people that have contributed to our school's ongoing success. This is a link to the podcast webpage, and you can also find it on iTunes and Spotify. You can search on iTunes First Decade. It's the only podcast you'll find there with that name. So you might have seen the posters outside as you walk down with the quotes from the podcast, and if not, please take a look at some of those quotes, and you can use the QR code to listen. We have it outside as well. All 3 of those are now available, and that's the bulk of the series. And then next month, we'll be releasing an episode called Memories. So each of the 35 individuals who were interviewed for the 3-part series that we already have published told us the answer to what is your best memory from your time at QU Netter. And so we'll be compiling those into one as well. However, we want to have another episode that includes best memories, but we really want that to be inclusive of as many voices as possible from our community. So we'd love for you to share your best memory of QU Netter also. And there'll be a poster that you'll find near the reception. And if you have any problem finding it, please ask us. And that will take you, that has a QR code that will take you to a tribute site where you can do a very, very short video of your best memory as well. We'll also be sending out other communications about the podcast and contributing to the best memory episode. We will have a few additional episodes, and I'll be bothering our wonderful symposium speakers again at some point. And I'd love to do some podcasts with each of you as well, and any other topics related to our 10th anniversary. And I would like to turn it over to you, Mazel, to be closing remarks.
Thank you, Lisa, and once again, thank you, Francine. You know, I think I speak on behalf of all of us here today when I say our hearts are full. Our hearts are full after that wonderful presentation about your father, our namesake. Our hearts are full in thinking of the generous gift from Barbara and Edward Netter, and of the generous spirit that has really infused our school in the last decade. I'm just going to use a low-tech prop that you already have. And I just wanted to remind people just how special this design is. Not only does it include a heart illustration by Dr. Netter, but each of our speakers today contributed a heart illustration as well. And I think, you know, I focused on generosity, creativity, and humanity. And as we're leaving and going to the reception, I would add to that love. As I've listened to the podcast of the oral history of the school and from my own time here, this is a community of love, love for medicine, a love for art, for humanities, for science, and that magical intersection of them. So thank you, everyone. Please join us just around the corner for a wonderful celebratory reception. And if you haven't made it upstairs yet, it's a real treat. We have original artwork by Dr. Frank Netter. We'll have a classical guitarist up there as well. And you can also see the beautiful illustrations that were submitted by our professional artists and also our student artists. They're up there for display. So thank you again, and look forward to seeing everyone at the reception. Thank you.